IntubateCOVID is an international registry that's aimed at helping us to understand what the risks might be to providers who are performing airway procedures and other high-risk procedures for patients with COVID-19. Placing a breathing tube can be a very risky procedure for both the patient and the provider in the context of COVID-19 because during this procedure, the provider is potentially exposed to aerosols and droplets that come from the patient's windpipe. So what IntubateCOVID focuses on is tracking those intubations or breathing tube placements and then tracking the health outcomes of the providers who are actually performing those procedures. Our registry is focused on clinician outcomes and clinician safety. We ask clinicians to voluntarily register and enter their own case data and then return to the website at a week, 2 weeks to tell us if they have new symptoms, if they've gone to the hospital, or if they've been diagnosed with COVID-19. I'm a health services and clinical outcomes researcher, and when I saw the conversations in my community start where people were asking questions about what their risks were as professionals, I wanted to know what I could do to help contribute to this dialogue. We reached out to our research network that I lead for other projects, as well as contacts across the world in the anesthesia research community. And that's how I found my way to this amazing team at Guy's and St. Thomas Hospital in London, who had recently started a registry for the National Health Service hospitals there. Over about 4 days, we figured out how to turn it into an international registry. The United States was the first country to go live after the United Kingdom. It's been an amazing grassroots collaboration between anesthesia care providers across the world who all are committed to answering the same questions. We've had the generous endorsement and now also support of essentially all major anesthesia organizations in the United States, including the American Society of Anesthesiologists, the Anesthesia Patient Safety Foundation, the International Anesthesia Research Society, the Foundation for Anesthesia Education and Research, and the Association of University Anesthesiologists. So it's a great story about how a grassroots effort has really expanded, gotten widespread buy-in from essentially the entire national community of anesthesiologists. And hopefully we'll be able to produce some information to keep people safe and help us prepare for the next epidemic.